Dame Donna Kinnair is the Chief Executive and General Secretary of the Royal College of Nursing and joins us now. Lovely to see you, Donna. What are your nurses going through at the moment if they're working on a COVID ward?
Well, I think our members are telling us that they've been under the most immense pressure, as you've just heard the head of the NHS say, that we have had a nursing workforce crisis because many nurses themselves are getting sick. But actually, they've just been struggling with this virus as we hit this third wave, as indeed they've been working since March.
Does that word overwhelmed feel right to you then? We hear it time and time again.
I think it does feel right now because actually it's highlighted what's happened when you've got tens of thousands of nursing vacancies in NHS England. And we know that critical care bed occupancy is reaching levels that can be unsafe. So, of course, our nurses are stepping up to the plate. They're doing the best they can. But each and every single one of those patients need highly trained nursing staff.
Have you got nurses who are being asked to cancel leave, for instance?
I'm sure there are because, as you know, we have 450,000 members and there will be nurses in Essex. But I certainly spoke to nurses this morning that were telling me that they have been overwhelmed with the amount of patients walking through the door and with the high level of occupancy in critical care.
Donna, what's your understanding of why we're not seeing the Nightingales being used at the moment?
Well, of course, one of the things that is a problem is that you have to staff the Nightingales. And it was almost fine at the beginning of this pandemic when we locked down everything else. And actually, we stopped giving cancer care and all the rest of the care that is essential. We know that we can't afford to do that now. So actually, we have a staffing crisis that means that we cannot do everything. Now, many hospitals are trying their best to keep essential services open, like cancer care, but we know with the rise in the numbers going back to above the level that we saw at the beginning of this pandemic or at the peak of this pandemic previously, that actually we've got problems.
In some other countries, we know that frontline medical staff have been amongst the first to be vaccinated. When are your nurses expecting to get the vaccine? What have you been told?
Well, we've been asked, we've been told that actually one of the things it was deemed that health and care workers were a priority for the COVID vaccine. We know that we needed older patients over 80 and they're being vaccinated at the moment. But we know that it's essential that all nursing staff get this vaccine to be able to continue to work and deliver care safely to all patients.
And Donna, when you look to the long term, how worried are you about the mental health of some of your nurses?
I think that's something we have to address. We're trying to address it now, but obviously when you're giving your best, you don't have time to think about yourself. It won't be until we get some let-up that will kick in, that people will recognise that their mental health has been impaired by some of the things they've seen. Now, you know, nurses all over, don't forget, are witnessing not just patients suffering, but also some of their colleagues as they've nursed them. And this morning I was talking to a nurse that sadly told me that they had a patient in intensive care, and in fact just after lunchtime another nurse told me that one of their colleagues had passed away. So you can see that it's the care they're giving, it's nursing their own colleagues in the storm of it, as well as losing their friends and families and colleagues.
Dame Donna Kinnair, thank you for joining us. It's so hard for your nurses at the moment. I hope you know there's a lot of empathy and support for them right around the country. Thank you.
Thank you.
Margaret Keenan, the first person in the world to